That's good.
Hello. Today we are honored to have Dr. Karen Mader-Smith, who is Senior Staff Physician at Baylor Scott and White Clinic in Manor, Texas, which is only 14 miles from downtown Austin. I am Marva Bennett. I am president of Manor Toastmasters, as well as a realtor with RE/MAX Posh Properties. Dr. Smith, share with us and give us some insight, first of all, on how you came to be assigned to Manor, as well as what things were like for you in the city and the clinic medically before we even had the pandemic and COVID-19.
Sure. Let me take my mask off. I'm inside now, and we don't have any patients in the building. I wear my mask just like everyone else, a cloth mask when I come to and from work. And when I get here, I use medical grade protective equipment. This is our beautiful waiting area. And we're going to take a quick tour through the clinic. And to answer your question, the way that I came to be here, do I need to turn my camera on?
No, this is good. You can turn it if you like, and then turn it back when you finish.
Let's do that. Yeah, I'm going to get the door open.
Security is always great.
This is the clinic. We have our procedure room where we do all kinds of office-based surgeries. We have beautiful artwork. This is our one central nursing station that really helps our team function like a team working together. This is one of my exam rooms. And we have 12 of these exam rooms. I want to show you one thing before I answer your question, Marva, because you're going to love this. This is our pediatric room, and the Manor High School art students did a mural for us in this room to make the children feel more comfortable. We had a contest, and Jade Singleton with the Manor ISD district, the art coordinator, actually had the high school seniors put on a business suit and present to us. These were their sketches. We kept them all because they were all wonderful. And these groups, that's of course the one we ended up choosing because it was so child friendly. These art high school seniors had to make a business presentation like a commercial artist would have to be able to win the bid. This is our lab. We draw blood right here on the premises. And this is our lovely, lovely state-of-the-art x-ray room. And I came to Baylor Scott and White in a very interesting way. My oldest daughter had decided that she was going to live in Austin. None of my other children had settled down yet. Oh, this is our break room. A board where we keep track of all of our metrics so that we make sure we're excellent. And this is where our doctors and our nurse practitioners and our PAs work. Back here, this is my little office. I've been doing a lot of telemed visits that I use my iPad just right here. I'm going to turn my camera back around and set this up. And this is what a telemed visit looks like for my patient.
Can you turn your camera sideways?
I can even do that. When I call my patients from home, this is what a televisit looks like. And they can stay safe in the pandemic. So the way I got to Manor was really interesting. I did my interview with Scott and White wanting to come to the Austin area. And they said, tell us what makes you happy. And I said, what? Is this a job interview? And they said, well, we have found out that patients do better when doctors stay. So we need to know what makes you happy because we want you to stay. And I looked at this woman, and forgive me, I said, Colleen, if you make me take care of rich people in the suburbs, I'm going to kill myself with a spoon. I need diversity. I need all income levels, all walks of life, lots of different people, lots of small children, and I would love to have people who speak Spanish. And she looked at me, and her eyes got really big, and she said, you need me. And I was like, what did I just do? Because she was so happy she had found someone who was a good fit for this community. She was right. I love Manor. So we bought a house 5 minutes from the office and made a permanent home here. So I really feel like a small town doctor, even though I work for a very large hospital system. The system has been great to work with. I used to be a practice owner. I had my own private practice for years. I like this better. I can focus on patient care and on science and let people who are really great at business and logistics run those things for me. And they leave me alone and leave me free to practice great medicine. So I've been super happy working for Scott and White. I think they found me a good fit for me.
Well, that's wonderful. I'd heard that story and it's so interesting. And I would like you to share some of the community outreach activities that you have done prior to the pandemic. And then maybe you could comment on how that has had to change or any adjustments that you've made because of COVID-19.
Yeah. So my kids are all grown. I have 5 beautiful children. I'm going to move the camera for just a second and I'll show you them. These are my sons and my daughters. And they're all grown. Those pictures are actually several years old. And in coming here, I decided that I wanted to create a nonprofit that would help children. And I did some research. Where in the greater Austin area are there kids with needs? Where can I find a real need and meet it? Not do what I want to do, but find out what the community needs done. Turned out Manor was one of the places that had needs, and I had no idea, and I had already ended up here. And so I began to work with the school district. I did some after school clubs. And I told a friend while we were doing some volunteer work in another organization here in town, my dream is to start a free clinic. This is what I'm going to do one day, nights and weekends, for the uninsured. And she said, well, you need to meet Mark Longley. So Pastor Alex Montesvila, that you interviewed last week, Mark is a leader in his church. And they were working with Episcopal Health Foundation to use the Episcopal Health Foundation resources to help communities that had medical needs and needed more access. And we worked together with about, I think we have over 100 volunteers now. And we have a core group of 20 to 40 at most of our meetings. We brought in business leaders, we brought in management leaders, we brought in entrepreneurs and accountants, we brought in nursing, social work, educators, and volunteers, translators, dentists. We really wanted everyone at the table to share their expertise, and the result has been just a really effective free clinic once every 3 months. And the school district has graciously let us use an empty building for the time being because we are serving their families. And so it's been a collaborative venture with the Chamber of Commerce, the school district, the nonprofit, and several area faith groups and churches. It's just been wonderful.
Well, I think that is such a great example of leadership and speaks to just your entire spirit. Have things changed in how you're able to carry out some of the activities that you previously started? What have you noticed that had to change to be in compliance?
So it's hard to hold the clinic during an epidemic. And we did have to cancel our April 18th planned clinic. We have a bunch of volunteers who aren't happy unless they're helping. So we had another project fall in our laps. A friend of mine is a professional contact, and she's the program director for the Department of State Health Services, DASHS, for community care for the aging and disabled. Ms. Rodriguez, this program director, is over 30 counties, including Travis, and she came to me as a friend crying and said, our older people and our disabled folks who were shut in before the pandemic aren't getting their services, and no one's talking to them, and they're very alone. Some of them have problems. So the Manor Health Alliance has now created the Reach Out Texas phone program, where anyone who has a few minutes can adopt a neighbor and call them 2 or 3 times a week to check in and be their friend. And if in the process you find a need, maybe their power's off, their water's off, they need groceries or food, then let us know. We have a fulfillment team working with the Department of State Health Services and multiple nonprofits to meet that need. But the first goal is friendship and reaching out. And we are taking all comers. We have created a toolkit that we can give to a civic organization or a faith group to do their own outreach, or you can nominate neighbors and nominate volunteers through our online Google Forms.
You know, it's amazing how big of a heart you have. And I honestly will just say that I think the Lord has put your business sense to work, how you've talked about processes and systems and toolkits. This is exactly what leadership is all about. And I know that the mayor, Larry Wallace, Dr. Wallace, and the Manor Chamber of Commerce, I've heard you speak many times there, the entire community, including Father Alice, we are so honored and proud and blessed that you came into our lives, and you have the best smile. So is there anything you would like to say as your parting words to the audience about any of the concepts you've talked about?
I think it's important in a tough time that we find each other, reach out to each other, and hold hands. I think we need to build safety nets for others. There's a lot of negative we could focus on, but if we can build unity and help, I think that would be a great thing. I want to show you one thing. This is my basket. These are my masks. I have a mask for Tuesdays. I have one for Tuesdays, Wednesdays, Thursdays. I have a helmet that I reuse, a face shield, and I have a more secure mask that I reuse. We have been so careful at Baylor Scott and White to preserve our protective equipment that I have been using these masks for 2 or 3 weeks now. The germs die in a paper bag within a few days. And this way we don't waste masks and we have enough for our hospitals. But we wear masks full times, and we are here to protect you. If you come to our clinic, we will check your temperature and interview you before you come in the door. If you don't have symptoms, you will never be in a room where someone was with symptoms. We're taking it seriously, and we hope that the rest of the community will too.
Those are such wise words. Well, thank you so much, Dr. Karen Mader-Smith, the senior staff physician at Baylor Scott and White in Manor, Texas, which is only 14 miles from downtown Austin. We appreciate you, and you have a great day.
Thank you, Marva.